some of our recordings onto YouTube so that people can watch it back, or they can use it for their teams or their family members. So if you want to turn your cameras off, you are more than welcome to. But we have started recording now, and we will have time for questions at the end, and we will turn the recording off so that you can speak freely. Okay. Like I said, welcome to tonight's education session. It is a positive approach to dementia care, and it is all about you guys, the carers of people, supporting people living with dementia. My name is Kathy Kirby, and I'm a registered nurse and a director at Thrive Aged Care. And with me today, I have Kate, who is also going to be speaking tonight. Kate is an occupational therapist, and she's also the director at Thrive Aged Care. And together we have known each other for about 15 years, a bit less. And we have both worked in health, aged care, community settings and government settings as well for the last 20 years. We both have a really big passion for older people, and in particular, supporting people living with dementia. We both still do some clinical work, so we are very across what's happening out in the community and in residential aged care. But we started Thrive in January last year, really because we wanted to change things up. We were doing a lot of work in compliance, and we were seeing similar issues pop up, and dementia being one of those. And we thought, we really want to just teach people the skills and give them the knowledge and the confidence to be able to do their jobs well from the beginning. And then we won't have issues popping up down the track. So that's why we started Thrive last year. And here we are today. We do lots of different things, but education is our main passion, and particularly education around dementia. And that's why we're here today, being Dementia Action Week. So tonight we're going to cover off a few different things. We are going to talk about how the brain works, and the changes that we can expect to see for people living with dementia. We're going to talk about the sensory changes that can occur for people living with dementia. We're also going to give you some practical tips that you can use to support the person yourself, and also how to manage your own stress, because that is a big part of being in the caring role. And we're also going to teach you how to adapt your approach that's going to allow you to have better connection and be able to engage more with the person living with dementia. And this doesn't matter whether you're a carer, a husband, a parent, a sibling, or if you're working in the healthcare setting as well. These are all tips that can be used by everybody. Now, like I mentioned at the start, we will have time for questions at the end, and we will turn the recording off. But to get us started, if you know how to use the chat function, I'd really love to ask you a few questions. If you want to pop it in the chat, please do. Otherwise, feel free to just maybe think to yourself or write down a couple of notes. When you think of dementia, what is something that you think of? What's a word that pops into your head? And the second thing that we want to think about is, what are two strengths that your person that you are supporting who is living with dementia still has? Yeah. Okay, we've got lots of comments coming through. Here we go. Oops, sorry. Memory loss, confusion. Yes. Two common symptoms that we see with dementia. What about some strengths? What are some things that you've noticed that are still, still working well for your person living with dementia? Okay, we might move on, Kate, while you guys are thinking. Sense of dementia. Still able to engage and wants to engage with the world. Amazing. Two really positive things there. A sense of humor. We all love a sense of humor. Absolutely. Sense of humor. Yes. Thank you. Great. These are some really key things, because sometimes we get caught up in, what isn't going so well for a person living with dementia. But, sometimes we need to put our thoughts back into what is actually working well still, what strengths still remain. So before we jump into talking a bit more about dementia and the changes that can occur, we want to pause for a second and we want to acknowledge ourselves as carers, yeah, because we're all doing our best, yeah. We're doing what's best, for ourselves, and we're doing what's best for the person that's living with dementia. But it is a challenging time, yeah, and it's challenging not just for ourselves, but for the person living with dementia as well, and those people who are supporting you outside of that caring role. And oftentimes there's a lot happening, yeah? And where does our focus always go? I've been doing this a long time, so I can speak freely. The carer is always focused on the person that they're caring for. The person that they neglect is themselves, yeah? And if we don't take care of ourselves or accept support from the people around us or accept support from those specialist services that are out there, which we'll talk about a little bit later, we're going to experience burnout because it is a challenging time. There's going to be lots and ups and downs, yeah? If we burn out, then we're not going to be good to anybody, okay? So we really wanted to start this session talking about how we can focus on you, all right? Because your role as a person caring for somebody living with dementia is really important, okay? So we're going to give you tips and strategies throughout this whole session about how we can support you, yourself, and also support the person living with dementia. Now, I wanted to start off with, what is a common scenario, I think, that I've certainly seen, and I still do some community care as well for people living with dementia. And this is, let me know in the chat if this is something that you've experienced or sounds slightly familiar to you, yeah? So imagine that you're going to pick your mum up, to take her out to a doctor's appointment or a dental appointment, okay? So you've rung her up and reminded her the day before, you've left a note, you've rung her up to say you're on the way, and then you turn up to the door and you knock on the door and it goes something like this. You open the door, oh, Mum, oh, you're not ready yet. We're going to the shops, remember? We've got to go and get your eyes tested. Remember I told you yesterday and I left you a note and then I called you again this morning, but you're not ready. Okay, all right. All right, Mum, we're going to be late. It's cold outside. You need to wear something else as well. Like that t-shirt, it's not going to be warm enough. So you're going to have to get a jumper too. It doesn't matter which jumper you get, just go and grab a jumper. Anyone will do. And let's go because we're going to be late. Yeah. Does that sound like something that you might have experienced or a similar scenario where maybe, you've done, yes, I'm seeing a thumbs up. Something that you've prepared as much as you can for. Maybe you've left work to take Mum to the appointment. Maybe on your way, you've realised that you didn't get petrol and now petrol prices have gone up. So you've just spent an extra $20. So you're stressed from that as well. How did you feel though, when I was talking to Mum? What did you notice? Yeah. When I was talking, and how was I communicating with Mum? Stress. Yeah. So you could pick up just from our interaction with me talking to you in that scenario, you could tell that I was stressed, couldn't you? And how could you tell that I was stressed myself? And rightly so, I might add, yeah, because I've got a lot going on. You could probably tell by my tone of voice, by my facial expressions, by my stance, my body language, yeah, tone of voice, yep. What else did I do when I was communicating with Mum? Yeah, when I came in and I knocked on that door and I opened it and Mum wasn't ready, I launched into a lot of talking, didn't I? Yeah, I used a lot of words. I gave out a lot of instructions. I was very rushed. So when I was talking quite quickly because I'm stressed and I'm late and I'm already late as it is and you're not ready and I need to we need to move this along, yeah? So I was speaking really quickly. I was a bit stressed in my tone, which you guys have picked up on. And did I allow Mum much time to think? Or take in the words that I just said to her? No, yeah? So how do you think Mum might have felt in that interaction. Thinking about, you know, we've told mum that we're coming on multiple different ways, but to mum, you've just turned up. I've just turned up on the doorstep. Yeah. Yeah. Overloaded, overwhelmed, even worse. Great. Absolutely. Yeah. Now, was that our intention? Was that my intention? Absolutely not. My intention was to go and take mum to her doctor's appointment that she needs to go to. Yeah. Oh, and planned on, you know, having a nice coffee with her while I was out as well. But that didn't come across because my stress, you know, has exacerbated, you know, that situation as well. So how am I feeling after that interaction? Probably not great myself. Okay. So when we talk about survival mode, when we talk about when we're in a stressful state, yeah, we go into survival mode, right? Survival mode being like that fight and flight, like that, you know, our responses, you know, increase. You know, we're quick to, you know, get a little bit fiery. We start feeling tense. Yeah. We become, you know, think about when you're stressed. How do you feel? Your body's tense. Yeah. Your jaw becomes tense. When we're stressed, we hold our breath as well. And when we hold our breath, we're not getting much oxygen to our brain. Okay. When we don't get oxygen to our brain, our emotional center, which is the front of our brain, is affected. Yeah. And this is the part of the brain that helps us make good decisions. So if that part of the brain is becoming stressed, what's going to happen to us? We all know when you can think to any stressful situation that you've been in, do you make good decisions? Not always, yeah. Do you do things that you wouldn't ordinarily do? Yes. Yeah. So that's what happens when we are in a stress state. Our brain is affected. Now, if we consider a person who is living with changes to their brain, being, you know, dementia disease, they still experience stress as well. So imagine the impacts that the stress is going to have on that person as well as the impacts of, you know, the dementia on them. So how can we, sorry, next slide, thank you, sorry. So what can we do, right? Because sometimes we can acknowledge that we're stressed and sometimes we can't. And this is something that we really want you to take away from today, is trying to take that pause and take that breath. Yeah. Breathing is really important. I used to be a person, I didn't actually always notice that I was holding my breath until somebody actually pointed out to me and said, do you realize that you haven't breathed in quite a bit? And I thought, oh, haven't I? It's because I was stressed and I was actually holding my breath. So I'm very conscious now of focusing on my breath. And something that I do quite often is pause and take 3 deep breaths. So let's do that together. So breathing in. How much better do you feel just after that simple thing? And it took about 5 or 6 seconds. 5 or 6 seconds of taking a few breaths is not going to impact on you being much later to your appointment that you're already late for. What it does, though, is calm your nervous system. So it's really important. It's getting that oxygen back to the brain. It's helping to reduce that stress, okay? Something else to do to help you regulate your stress is to laugh. You know, what's that old saying? It takes less muscles to smile than it does to frown. Yeah. So when you're laughing as well, and it's great that you guys said about having a sense of humor retained, you know, laugh. You know, laughter also helps us to breathe, which again helps us get that oxygen back to the brain. And lastly, if you have stress that is overwhelming and that you can't, you know, you can feel it sitting there and you can't quite get on top of it, you need to take a break. You need to ask for help. Yeah. Because you being stressed and continuing to soldier on and try to offer that support to the person we just saw, you know, the impact of that, the impact that has on the person living with dementia, because they can pick up on our stress. So you are much better off saying, hey, time out. I need some time and I need some help. Yeah, because it'll be better for you, for your own health, and for the person living with dementia. Okay. Now I'm going to hand over to Kate to talk to you for a little bit.
Thanks, Kathy. All right, so today we are talking about a positive approach to dementia care, and some of you on the call might have heard about it. Some of you might not have heard about it, but this is an approach that was developed by an OT in the USA, a dementia expert called Teepa Snow. Okay. Now, the positive approach to dementia care is all about adapting our approach, and it's about how we adapt our approach to support people who have brain change. So people with dementia who have changes going on in their brain. And it's all about how we can make life better for both of us, because the relationship comes first with a positive approach to care. Okay. It's an evidence-based approach, and anyone can be trained in a positive approach to care. And tonight we're going to be talking about some of the elements and giving you some tips from that approach. So why does approach matter? And you can see on this slide that only 7% of how we communicate is via words. Our senses take in information from our environment, and our brain processes that information to make sense of it so we can respond in a way that makes sense, okay? But for people living with dementia, their brains are going through change, and this will affect their ability to take in information and also how they process that information. So today we're going to talk about these sensory changes and how we as carers can adapt our approach to meet the needs of their changing brain. Okay, so to better support them with how they might take information in and how they process it. But before we get into it, I just want to, we are going to show you some real images of the brain over the next 2 slides. So this is a bit of a warning, okay, a bit of a warning, but I think it's important and it really gets us thinking about the changes for the people that we're supporting with dementia, okay? So over we go. We're going to show you some pictures of the brain. So here we have two brains. Okay, before we start, we know that the brain is made up of 2 parts. We've got the left and the right hemisphere. Okay, so go ahead, wherever you are, make your fists and put them together. That's your brain, your left and your right hemisphere. We know that the brain is really complex. You know, our left side controls what our right side does and vice versa. And here on this image, we can see brains from 2 men. And these 2 men were roughly the same age, the same height, and the same head circumference at the time of death. The brain on the left is from a man who died in an accident with a healthy brain. And the brain on the right is from a man that died with complications of living with Alzheimer's for over 10 years. So I want you to go back into the chat again, and I want you to just to comment, put the first words that come into your head when I ask you to think about what you notice about these brains. What do they look like? What sort of differences are you seeing? Oh, Peter has lost sound. Kath can hear me. I'm sorry, Peter. Might have to log in and out. Anyone else? Smaller, Kath. Yes, right brain is reduced in mass. That's right. So it's smaller. It's shrunken. Shrunken, Joe. I read your mind. It's shrunken. The unhealthy brain has shrunk. Yes, there's a lot of shrinkage, being smaller. Size and density has changed. You're exactly right. Yeah. And with that, you can see a lot of gaps. You can see a lot of black, can't you, in that brain living with brain change? A lot of gaps in between different areas of the brain. It's smaller, it's shrunken. Yeah, lots of change going on. Now we're going to look at the area of the brain that's responsible for vision. And we're going to start with vision because vision is the main sense that we rely on to stay safe. And for people with dementia, it's the main way that they take in information. So the areas circled are actually at the back of your head. They're just here. And it's called the occipital lobe. And it's the area that processes vision, okay? So again, I want you to think about the 2 different brains and the areas circled, and what are you noticing with those 2 different brains? Yeah, what are you noticing with the visual processing center in those red circles? Pop it in the chat. Different angles, bigger gap, yeah. So we've got gaps, different angles, bigger gaps, exactly it. The way that we process vision, less brain mass, that's exactly it. And the way that we process it in, you know, our eyes take in the sensory information, then that information has to travel all the way to the back of our brain for our brain to be able to process what we're looking at, for our brain to be able to recognize, for instance, that's a cup. Yeah. So given that, what sort of challenges do you think we're going to see for people living with dementia in terms of taking in visual information? Pop it in the chat, guys. What sort of difficulties might you be already seeing with the person that you're supporting? Distorted, yeah, so vision changes, yeah. Information may not get there as fast, exactly, Marie. So we're going to see slower processing because of all those gaps. You know, our brain, the wires aren't as connected as they normally are. Maybe misinterpretation, so maybe not being able to recognize what that object is or misinterpreting it for something else. Yeah, exactly. So lots of changes going on. One of the main changes that happen for people living with dementia is changes in visual field. Okay, so you basically, that's the area that you can see around you when you're looking straight ahead. So if you're looking straight ahead at your computer or phone tonight, and if you pop your arms out 90 degrees and you wiggle your fingers, right, you're going to need to bring them round to where you can sort of look ahead and you can see your fingers wiggling. That's your visual field, okay? So if we were 25, we would have our arms out and we would be able to have them out at 90 degrees and we'd be able to see our fingers wiggling. But I'm not 25, okay, I'm a bit older. So when you get to about the age of 75, your visual field is about here. Yeah, so every year you lose about 3 degrees. That's why, for instance, when you're older, you know, it's starting to happen with my parents, I can see it, their head checks, it starts to become a bit of a whole body movement because of a reduced visual field. So that's normal aging as we age, okay? But for people living with dementia, they have more visual field loss. Okay, so go ahead and do this. Put on a snorkel. Yeah. This is for someone who may be newly diagnosed or living with very mild dementia. Okay, that's tunnel vision. That is their visual field. I want you to go ahead now and make 2 circles and put them on your eyes as binoculars. Okay, binocular vision. This is how someone with moderate dementia will experience the world with their visual field. I want you now to go ahead and leave one binocular and cover one eye. And that's monocular vision. Okay, this is how someone living with more along in their dementia journey, someone with more significant dementia, this is how they will experience the world. So as dementia progresses, the visual field changes and gets smaller and smaller. Okay, so thinking about that, what do you think we can do a little bit better to support a person going through visual field change? Have a think. If you've got some ideas, pop them in the chat. Spatial awareness, Marie, that's another issue. Yes, exactly. With the smaller visual field, spatial awareness. Now, something you can do at home, we won't get you to do it tonight, but put your binoculars on and go for a little walk around your home, okay, and see how you feel, how you can find everything, or if you feel a little bit unsafe and unsteady. Definitely something that's impacted. We need to think about how we approach, not from the side. Exactly, approach from the front. You guys are on it. Yep. So they won't be able to see you if you're coming from the side, if you're not in their visual field. Yeah, and you'll shock me, you'll surprise me. Exactly. You're exactly right. Approach from the front. Yeah. Don't rush in. Move slowly. Wait until you've got the person's attention. You might do that by using their name. If someone says your name, you're likely to look out for it. Wait until you get eye contact, and then getting onto the dominant side is where you want to be. Yeah, because it's much easier for people to attend the dominant side. Yeah, so if you're speaking with someone, try and be on their dominant side. Get on the same level. Yeah, so if they're sitting down, get to the side, crouch down to be at eye height. Don't stand over the person, because that can be a confronting and intimidating stance. And like Kathy said earlier with that scenario, facial expressions are really important and body language is really important, because people living with dementia still recognise these cues. Yeah, we still know if someone doesn't look very happy or if someone's looking a bit threatening. So it's really important to keep that positive, happy, friendly body language. And you can see in this photo here, that's me with my hand next to my face. Yeah, trying to get attention and staying still, not waving my hand everywhere, with a friendly look on my face. So there's some tips for meeting the needs of the changing visual field. The next thing that we want to talk about is hearing. Okay, now hearing sound is not affected by dementia, but the part of the brain that's responsible for understanding language is. Okay. Early in this, people will miss out of 4. How long got lost, do you think? Early in this, people will miss out of 4. How long before got lost, do you think? Oh, Kath, early in this. Okay, I won't yell. I can see she's not getting happy. Early in this disease, people will miss 1 out of 4 words. How long before you got lost, do you think? So dementia makes it hard to understand things when you're missing every 4 words. And for people with moderate dementia, it's likely that they're missing 1 in every 4 words of you saying. How did you feel when I got louder? How did you feel when my tone got a bit angrier? Were you confused? Why is Kate yelling at us? Yeah. So we know that hearing doesn't change with dementia. No. Although a person can have age-related hearing changes, but dementia doesn't cause it. But people with dementia can still hear tone, they can still hear pitch, they can still hear volume and intensity. Yeah. Exactly. And I'm seeing a comment, ensure no other distractions. That's important too. That's very important, because if you're already missing 1 in 4 words, if you've got the radio or TV going when you're trying to tell me something important, it's going to make it even more confusing for me. Yeah. So unless someone like you cares an awful lot, nothing is going to get better. Yeah. So we know what does change. So hearing doesn't change, but a person's ability to understand language does. And these images here of the temporal lobe, okay, just located here. The temporal lobe is the area of your brain that helps you to understand the world around you and to respond to it. The image on the left of the screen has the left temporal lobe only. So the one on the very left is for the healthy brain, and the one next to it is from the brain affected by dementia. So you can see the changes that are going on in the left temporal lobe. The image on the right has both the right and left temporal lobes, okay? You can see the right in the blue and the left in the green. Which lobe do you think is most affected by dementia? Having a look at those images. Is it the right temporal lobe or the left? It's the left. Left, beautiful, Dora, thank you. Left, exactly, the left temporal lobe. So with people living with dementia, okay, the skills that we have on the left, we lose, and the strengths that we have on the right, we retain. So when you get your fingers out, I want you get your left hand ready first and get your 3 still fingers ready, okay? So your left temporal lobe is in charge of 3 things. It's in charge of vocabulary, comprehension, and speech production, okay? These are our skills: vocabulary, comprehension, and speech production. On the right, get your right hand out, and you're going to need all 5 fingers for this one. These are your strengths. These are the things that are retained in dementia, okay? Forbidden word, all the swear words and sex talk and racial slurs and ugly words that you've ever heard in your life, they stay. Social chit chat, so turn taking. Hey, Kathy, how are you? Yeah, I'm good. That remains, okay? The third one is the production and understanding of rhythm of speech. So understanding frequency, intensity, volume, and knowing if I've asked a question. So how are you? What happens to my voice when I say, how are you? Would you like tea or coffee? You can hear the inflection. And so people can understand that it's a question. They might not know what you're asking, but they understand that you're waiting for an answer, like a yes or no answer maybe. The fourth thing, the fourth strength that remains is music, poetry, prayer, and counting, okay? And lastly, our automatic autonomic movement. So if I was to extend my hand to you, yeah, what would you do? You'd probably extend it back knowing that I wanted a handshake. So they're the things that we retain. They're our strengths, okay? So I want you to think language on the left, rhythm on the right. We lose on the left, we retain on the right. That's how you're going to remember what skills that your person with dementia will lose in regards to language and what they'll retain so that you can work with that. Now, you guys have put in a lot of great tips already about minimising distractions, and, you know, we've talked about visual approach. But when you're offering verbal communication, it's really important to think about these things. Yeah, allow time for response. So that's allowing anywhere from 3 to 5 seconds for a response because of what we've seen in the brain. Yeah, the changes to the connections are going to take longer for us to process and respond. We know that people lose 1 in 4 words, so use less words. Hey, Kathy, do you want to go to the kitchen and get a drink? Or, hey, Kathy, drink? Use more visual cues. We know that our visual field is changing, but vision is still the primary way that people living with dementia take information in. So use more visual cues to supplement the loss of skill happening with language. And watch your tone. Yeah, this goes back to the scenario that Kath introduced this session with. A person might not understand what you're saying, but they're going to understand your tone. Yep, so they may not understand all the words, but they're going to understand the tone that they hear. I'm now going to hand over back to Kath.
Thanks, Kate. And now we're going to talk about our sensory motor strip. So all up here, yeah. And then this is a picture of our brain that controls our motor senses or our movement, yeah. And we can see again that there are lots of changes that have happened to the brain. There's lots of loss of connection like Kate was just talking about. So this means that things that we might have done our whole life can all of a sudden become more difficult. So something that we think is a really easy task that we don't necessarily think about all the steps involved, let's say making a cup of tea, is actually quite complicated. There's a lot more required for us. It becomes more challenging. So people living with dementia lose skills before they lose strength. So skills, yeah, like using these fingers here, yeah. So things like doing up zippers, doing up buttons, writing, holding a fork or a spoon, you know, all those really intricate tasks, those require your skill fingers. And skills are one of the things that, that we lose before our strength. Our strength, however, is retained. So what's particularly retained is our protective mechanisms. So if a person living with dementia feels threatened or stressed, then their protective motor skills are going to kick in, okay? The ability to identify and tell the difference between our sensory input is something that is also experiences changes, okay? So this might mean that people have trouble telling the difference between hot and cold, between, you know, having pain or no pain. And someone, you know, sometimes touch is something that can be affected as well. So something that we might think is, you know, quite a light touch might be more sensitive for a person. A person might also feel things like the cold more, or they might not identify, you know, that there is, for example, they're making a cup of tea and they spill boiling water. Yep, but they don't notice that they've that they've poured that boiling water on their hand because their senses have been affected. This can impact on a person as well. You know, someone who might have liked, you know, quite a lot of touch in the past might not like that anymore because it's now feeling uncomfortable, or vice versa. Thanks, Kate. So when we're talking about movement and touch and tips around that, we want to move on. If we've tried verbal cues, so we've tried, you know, Kate, would you like a coffee? And Kate, like we just learned, is having trouble understanding the words or comprehension. Yep. So now maybe I try a visual cue. Hey, Kate. Yep. So I point out, maybe that's not quite enough either. Maybe Kate's not quite understanding verbal and visual cue. So what can we do now is we can use a touch cue. Yep. So we can help the person to get that action started. So we can hand the person the cup, like you can see in that picture there, you know, and maybe you might even need to help get that motion started. Yep, but that strength has remained. And then I might be able to continue that movement of continue that cup of tea, or, you know, brushing the teeth. What we want to do, though, is to aim to do with the person and encourage them to do as much as they can for themselves, not do for them. Because what we tend to do as caring people that we all are is take over. Yep, because we want to make sure mum has that cup of tea, or mum has that drink, or mum brushes her teeth. Yep. So what do? We come in, guns blazing, and we start being really helpful. And what happens is we take away a person's independence, and we, you know, we're not enabling them to use their strengths. So we want to, again, do that pause that we did earlier today, and we want to try and assist the person to get them to do as much as they can in tasks. So starting off by giving those verbal and visual cues, and then that touch cue, and maybe even just a little bit of a start. Yeah, and you're right, Kate, if you don't use it, you lose it. Yeah. We also just want to be aware, you know, of those sensory changes. You know, that can be something that's impacted, something that you just want to pay attention to. Does that mean that a person can't make a cup of tea anymore because they have sensory changes? No. It just means that you maybe assist a little bit more, or look at other strategies so that you minimize the risk of them burning themselves. It doesn't mean that we just stop them altogether from doing that task. Okay, thanks, Kate. Now we've just got an image here because I think it shows what we're talking about. Yep. So if you look in the first picture, it's very hard to tell what I was saying there, isn't it? But I was actually saying to Kate, would you like a drink? Because I'm a, you know, as you can tell, I'm a handsy person. That's what I was asking her. But you can't get that. That could mean a million things, couldn't it? Doesn't tell you much of the story. So then we put in the visual cue. Oh, it's making a little bit more sense. And then finally, we have that tactile cue. Yep. So really getting that person started. So just a little reminder of how you can, what those 3 cues might look like. Thanks. Now we're going to move on, and we're going to talk about changes to taste. And before we get started, hands up here, I'll put in the chat, how many of us eat the exact same foods and the exact same drinks every day and have done for the past however many years you've been alive? Probably not many of us, because I know, you know, my taste changes all the time. And something that we want to be aware of is that our preferences change, and that's okay. My preferences change on a daily basis too. I like coffee. Everyone knows I like coffee, very specific order, but I also drink tea when I'm at a certain friend's house. I also drink herbal tea on certain occasions. My preferences change, and just because a person now has dementia does not mean that they stop having changes to their preferences as well. Because sometimes we'll say, well, you know, mum didn't used to drink coffee. Well, you know, maybe not, but maybe, you know, her preferences have changed, and maybe also it might be to do with something with the changes to their taste buds, you know, as a part of the dementia. So just keeping in mind, we are allowed to change our mind and our preferences, but on top of that, there are brain changes that occur that can affect our taste and our smell. And if any of you experienced one of the common symptoms with COVID, which was loss of smell and loss of taste, then you know what that feels like. Yeah. This is something that can be experienced with a person living with dementia. Okay. Something else that can happen is that people develop cravings for stronger flavored food. So that might be sweet food, or it might be salty food, or they might start enjoying unusual food combinations. So they might start eating sweet and savory foods together. Yep. It's because there's been actual physical changes to that part of the brain. Thanks, Kate. Now, this is a common scenario, you know, oh, Dad used to never have sugar in his coffee, and now he's having 3 or more teaspoons. Why is that? Yep. Well, it's because the bitter taste is actually what remains the strongest. Yeah. And I actually was thinking today about my friend who had quite severe COVID, and thinking back to then, and she had, she experienced altered taste after COVID, and it really affected how she tasted common foods. Yep. So things that used to taste a certain way tasted really bad after that for quite a while. And maybe some of you have experienced that. But what might this look like? So if you've got those taste changes, and you've got, you know, changes to your smell as well, things that you might hear as a person supporting the person living with dementia, you know, you've cooked their usual recipe and they come back and say, you know, that doesn't taste right. It's off. Yeah, there's something wrong with this soup. It's not okay. Or, you know, you didn't put any sugar in this coffee. Yeah, because that's relating back to what they're actually experiencing. It's not them being challenging. It's not them, you know, having a go at your cooking. It's something that they're actually experiencing. Yeah. It's challenging for you and probably very frustrating, because you know, we spend a lot of time and effort putting in, you know, meals and drinks, but it's not the person trying to be difficult for us. But what can we do to support that person? Yeah. What are some top tips? Again, be a little bit less helpful. Yeah. Get the person to help make the dish, or make the drink themselves, because if they're involved in the process, then they can help to see as well that you have put that sugar in, or, you know, they can see what ingredients have gone in. That can be one thing that can help. Try substitution. So use sugar-free sugar, you know, sugarines. Use sugar-free soft drinks, for example. Yeah. Oh yes, I had a lady who never put honey in her coffee, so I would add it in front of her. Yes, perfect. That was the next thing. Do it in front of the person so they can actually physically see you. Does it work all the time? No, it doesn't. But also, again, our next tip is to pick your battles. Yeah. Take 3 breaths, avoid arguing, because if you're, you know, who do you think is going to win the argument? It's probably not going to be you. Yep. And what's going to happen? You're both going to end up stressed. And at the end of the day, does it matter if there's 5 sugars or 3 sugars? It's not ideal, but, you know, sometimes you just have to accept and move on. Yep. I just want to give you a quick scenario, which is like one of you just said. We had a client whose name is John, who's not his real name, who was that exact same scenario. He used to drink black tea with no sugar. He then all of a sudden had an urge for white coffee with lots of sugars. And we had to do exactly that. We, you know, our lovely volunteer took him a coffee with his sugars, and he said, there's no sugar in this. So she said, yes, there is. And he said, no, there isn't. So then she gave him some more sugar. That didn't work. And then we took him over to make his own coffee and to put his own sugar in. Did it work all the time? Not always. But what did we do? We used substitution. Yep. So we used sugarine instead of real sugar. And then instead of offering coffee all the time, we offered different drinks to him. So we took away that option of the coffee, which were all the sugar. He quite liked soft drink as well. So we offered him sugar-free soft drink. And that was a different way to get this, the same outcome. Yeah. Oh, back to you. Sorry, Kate.
Oh, awesome. No worries. Now, taste is really interesting, and it's obviously linked to smell. You know, it got me thinking with COVID, Kathy. So obviously taste can change for someone living with dementia, and so can smell. And The impact for smell is having losing an ability to distinguish like safety smells. So the smell of smoke, that chemically smell, that smell of bleach, spoiled food, urine or feces. So the ability to distinguish these smells, and if you know what they are lost quite often in stages of dementia. So it's really just important that you're aware of this for your loved one's well-being and safety. And you might notice this with personal hygiene. So for instance, you might notice that someone's been wearing the same clothes that they've worn all week, and maybe they're finding these clothes on the floor or in the laundry hamper, and they're putting them back on, not even realizing that they're dirty or that they smell. Now, what do we do? Now, if you're like me, you wear the same jumper that you wore yesterday, you give it a sniff, don't you? You give it a sniff and you're like, yeah, it's all right, I don't have to wash that. So that's lost for someone living with dementia, okay? So I guess the main thing is about being aware of that. Now, people living with dementia do retain the ability to sense other smells, and we know that smells are directly linked to our emotional center in our brain. So often smells can associate positive memories, right? What do you think about when I say cut grass? Is there a particular time in your life that you think about? Is it spring? Is it happiness? What do you think about when I say freshly baked bread? Okay, these might trigger really nice emotions for you. Now, that's really important because the smell of appealing food like freshly baked bread has actually been shown to have a positive effect on mealtime and a positive effect on appetite. Now, what happens when we smell something yummy? It happened to me the other day, actually. I didn't even realize the kids had some crumpets. I haven't had a crumpet for years. I smelt these crumpets and my tummy started to rumble. Yeah. And I could feel myself salivating. I had to go make myself a crumpet. Okay. So it gets us ready to eat. So if you've got someone who maybe mealtimes are becoming a little bit more difficult and you're worried about them getting enough intake, think about what smells are happening before mealtime. You can even get people involved in that experience as well to really set them up for success. So really, there's things that you can do to, I guess, address the safety issues. But I think the main one is just, I guess, being aware of the sensory changes in smell that people might not be able to smell: urine, feces, personal body odor, chemicals and smoke, and, use other strategies. So for instance, hey, Kath, hey, you got a little something here. You got a little something here. Oh, let's go change your top. Yeah, that's going to work better than, hey, Kath, you've been wearing that all week and you stink. You can't come out with me like that. Yeah. So we just have to, again, pick our battles and try a different approach. Now, we know from carers that one of the most frustrating things about supporting your person living with dementia is constant and repetitive questioning, often about the same thing and often about a question you may have just answered a few minutes earlier, okay? The reason for this change is because of changes that are happening in the hippocampus, and that's the memory center of the brain. And for people with Alzheimer's disease, it's often one of the first areas of the brain affected. The way we retain information is like a filing cabinet, okay? We take the information in from our senses, our brain analyzes it, it determines if it's important. Is it something that makes us feel good? Is it something that we're going to need in the future? And then it files that information in our storage cabinet in our brain, okay? As we age, as our filing cabinets get full, it might take us longer to access that information, but generally we do. That's healthy aging, yeah. But for your person living with dementia, they may lose the ability they do lose the ability to file new information. So they might not be able to, for instance, find themselves around a new environment, or they may ask you again for the 10th time today what time their appointment is. They still have access to the old filed memories, yeah, and quite often the memories stored a long time ago in the past remain accessible. So your person might remember something that happened 40 years ago, but not something that happened 5 minutes ago. And it's all because of the changes happening in the hippocampus. The hippocampus is also responsible for awareness of time. So I know what time of day it is. I know what time of year it is, or, what time of the week it is. I know where I am in my life, that I'm in my 40s, and, But for a person with dementia, this well-ordered timeline becomes a bit more like a salad. Yeah, pieces are chopped up and they're kind of mixed together, okay? So your person is not experiencing time like yourself or myself, but rather they might be connected to memories of themselves and their lives from another time, maybe 40 years ago, maybe 50 years ago, okay? The hippocampus is also responsible for emotion and learning. And emotion's a big one for us and the person that we're caring for. Yeah. Now, this isn't going to change for the person living with dementia, their ability to retain information. Okay. There are some strategies, and as an OT, there's strategies that we recommend to assist you and the person to manage situations. Like, if you're asked multiple times about appointments or other questions, the use of calendars and diaries and other techniques or redirection. But the most important thing to consider is that even when you're answering the same question for the 5th time, it's not going to change for your person. They're not doing it deliberately, but what we can change is how we respond and our expectations. Yeah, and that might make all the difference for the person that you're supporting. It might make them feel heard, validated, safe, and it actually might stop them asking that question. So our response might actually have that effect. Yeah. Now, we're going to go back to that situation where we feel stressed. Yeah. So, and when we're asked a question, so the 10th time that morning, that's exactly what Kath was describing, when we can feel stressed. And we show that, even though we're trying not to show that, we show that through our body language. We might show that through our tone or our words that come out of our mouth. People living with dementia also get stressed and they get frustrated and they get upset. Yeah. How our brains change when we're stressed is the same for us as it is for the person that we're supporting with dementia. And if we don't make good decisions when we're stressed with a healthy brain, how do you think this might affect your person that you're supporting who is experiencing brain change? Now, this slide here is interesting. It's a PET scan. Yeah. So when we get stressed, we still have our reasoning skills. We have our skills in our prefrontal cortex. Yeah, these are the skills that help us make rational decisions, that stop us acting impulsively, that let us have insight into our behavior and see other people's points of view. These are the skills that may stop us from telling someone what we really think about them or giving someone a whack. Yeah, they're the things that say, no, Kate, you can't do that. It's not right to go hit that person who cut you off in the car, even though you'd like to. People living with dementia have changes occurring to these skills, these prefrontal skills. So they don't have the ability to think rationally or to control their impulses or to even consider their safety or self-insight or, considering your point of view. Yeah. So this PET scan here shows the metabolic activity of the brain. The red is the glucose, so it's the areas of the brain that are firing, okay? What you're seeing here on the left is a normal brain. You've got a brain of someone who has early Alzheimer's, late Alzheimer's, and then the brain of a child, okay? The white circle at the top is this prefrontal cortex. Yeah, it's the rational skills. The black circle is the primitive brain. It's the hippocampi, and this is responsible for keeping us safe and for living. The primitive brain keeps us alive. It's our fight, flight, fright, hide or seek response. Yeah, it's what we kind of do automatically without the thinking. So what you can see here is the person with early and late Alzheimer's still has that primitive brain firing. They've still got all those fight, flight responses that are keeping them alive and keeping them safe, but they don't have the rational skills here to, not be impulsive, to make good decisions, to consider your point of view, to know my limitations. They're the things they don't have. And they're the things that we need to be for them. We need to help them be those prefrontal skills. Yeah. The last thing, I think this is my last slide, the last thing that I want to say is we all know that supporting someone with dementia is a really hard gig, and You can't do it alone. Like Cass said, you need the team. You need people around you, at least 2 people who are your team. And, you know, if you've got some formal supports, that's very important as well. We know it's hard for carers, and it's also hard for the person that you're supporting. We know the person living with dementia has changes to all the skills that we talked about, especially the skill of your point of view and my self-insight. Yeah. So they might not be able to say sorry. They might not have realised that they've done anything wrong. But sorry is such a powerful tool to keep in your pocket, and it might help you when you're faced with challenging situations. And you can say it in different ways, but it is a tool to validate the feelings of the person that you're supporting, to let them feel heard, and it might help in lots of different situations. So again, keeping sorry in your pocket is a tool, you know, and there's different ways you can say sorry. So, you know, I'm sorry, I was just trying to help. I'm sorry I made you angry. I'm sorry I had no right to make you feel that way. I'm sorry that happened. That should not have happened. And I'm sorry that this is hard, and I hate that for you. So sorry can be a handy tool. And with that, I'm just going to hand back over to Kat. We're on the home straight of this presentation.
We are, thanks, Kate. And we are going to go back to that first scenario that we had, and we're going to try it a little bit differently now. Now with all the knowledge that we've got and the skills that we've learnt, let's try that scenario again. Yeah. Hi, Mum. You look nice. I like your t-shirt. Mum, it's cold outside today. Before we go to the shops, we should get a jumper. Yeah, let's go. Mum, would you like to wear the red jumper or the blue jumper? Yep. Now, I took a couple of breaths there after I saw Mum and noticed that she wasn't ready. Yeah. And then I paused and I gave her time to interpret the information coming in. I gave her a choice still, this jumper or this jumper, but I didn't come at her with a whole lot of instructions, and I was less stressed. Yeah. And taking that extra 5-10 seconds has not made me any later than I was going to be. Yeah. Thanks, Kate. So to wrap up today's session, are we perfect? Absolutely not. Are Kate and I perfect? Absolutely not. Yeah. We all make mistakes. But the important thing is that we keep trying. And hopefully after today's session, you got a little bit more understanding of how the brain has changed. And hopefully you got some more, you know, very simple tips that you can try. Even if you try one, you know, after tonight's session, that's a win. And like we said, you will have access to this recording. You'll have access to the slides. So feel free to go back and have a look at the top tips and give them a go and see what difference it makes. Now, our takeaway messages from tonight are that the relationship always comes first. Yeah, if you're caring for someone, you know, it's somebody that you're already caring for, and now you're caring with them. Yeah, and things like our agenda. So our agenda being that we want to take Mum to the shops in our scenario is something that we need to put in our back pocket. Yep. So we know that we need to take Mum to the shops, but that shouldn't be, you know, right out here for Mum to see. We want to maintain that relationship and maintain that connection. People living with dementia are doing their best. Yeah. They are experiencing brain change. So unless we choose to change, then nothing will change. And stress affects all of our brains, yeah, and it affects people's function. And, you know, this is the same for people living with dementia. They can experience stress as well. So we want to look at how we can manage our own stress so that we can minimize, you know, that impact on the person that we're caring for as well. And it's important for our own health and well-being. And managing stress and adapting our approach and really focusing on the person's strengths is going to set the person living with dementia up for success. And if they're set up for success, then so are you. So thank you so much. That's the end of our presentation. And Kate, I'm just going to remind you to Actually, Kate, sorry, do you want to go through just the slides and then we'll stop recording and leave time for questions, but I just want to run through those last few slides. Thanks. Next slide. Yep. So if you do need some more support, we are around. We offer lots of different things. We do a lot of, we do tailored education for lots of different services. If you have carers groups or volunteers and you're interested in knowing more or learning more, please reach out. We also do staff education. We do have some team members, and Kate and myself do some limited specialised clinical support. Kate, our very experienced OT, has a passion for the environment and particularly dementia-friendly environments. So she does reviews and makes suggestions that are cost-friendly to make environments more dementia-friendly. And we are also both COPE trained. So we have carers programs as well, which is OT and nurse-based. So if you're interested in that sort of support, then please reach out via email. And coming soon, we do very excitedly have a 4-week program that we are going to be running for carers such as yourselves. So yeah, register your interest with us via email if you would like to know more about that when it comes about. Thank you, Kate. We will send you a link for feedback because we were really keen to know what you took away from today's session, if there was anything that you were hoping that would be covered that we didn't, and any future topics that you would like to hear from us about. And now, Kate, could you maybe just wrap up the recording? We have those additional supports there as well, but we are very happy to take questions. We'll just make sure that we have stopped recording.